Prepare yourself for a revelation that could literally save your life. In today's video, we are diving deep into the hidden signs of one of the deadliest diseases humanity faces, pancreatic cancer. Known as the silent killer, it often develops undetected, showing symptoms so subtle that they're mistaken for stress, aging, or simple digestive issues. But your body does send signals. The key is recognizing them before it's too late. Why pancreatic cancer is hard to detect. Pancreatic cancer has no routine early detection test for the general population. By the time it's diagnosed, it's often advanced. Early detection increases survival rates by up to 20%, yet most people ignore the warning signs. Today, I'll walk you through 8 surprising symptoms that can serve as early alarms. To understand why early detection matters, think of the pancreas as a hidden engine of your body. It regulates blood sugar, digestion, and enzyme production. When it fails, the impact ripples through every system. The tragedy is that most symptoms appear only when the tumor grows large enough to press on other organs. That's why awareness is our strongest defense. Symptom 1, jaundice. The first sign is jaundice. Not the bright yellow skin you imagine, but a subtle golden hue in the eyes or skin, often mistaken for fatigue. Watch for dark urine, clay-colored stools, or greasy floating stools. These are early cries from your pancreas for help. To make this relatable, let's imagine you're brushing your teeth one morning and notice your eyes look slightly yellow under the bathroom light. You shrug it off, thinking you're tired. But days later, your urine is darker than usual despite drinking water. That's when you must act. Doctors often say, jaundice without pain deserves immediate investigation. Symptom 2, persistent itching. The second symptom is persistent, unexplained itching, especially on your palms or soles. It's not dry skin. It's caused by bile pigments building up in your skin. If it continues despite creams or antihistamines, don't ignore it. Many patients describe this itch as the most irritating discomfort of their lives. It wakes them up at night, interferes with focus, and feels like tiny pins under the skin. What's deceptive is that it may appear months before any other symptom. This is why dermatologists often play a key role in early cancer referrals. Symptom 3, weight loss and appetite changes. Third, sudden weight loss and appetite changes. Losing more than 5 to 10% of your body weight within months without dieting or exercise is a red flag. Pancreatic cancer disrupts digestion, prevents nutrient absorption, and creates a sense of fullness after just a few bites. Some patients report that their favorite foods suddenly taste unappealing, or that fatty meals trigger nausea. This is because pancreatic enzymes aren't reaching the intestine to break down fats. Think about it. Your body isn't just losing weight, it's losing its ability to fuel itself properly. Symptom 4, persistent indigestion. Fourth, persistent indigestion and bloating. If antacids don't help and stools turn pale, greasy, or foul-smelling, it could be more than simple gastritis. Chronic diarrhea or constipation linked with indigestion should never be overlooked. Imagine the cycle. You eat, feel bloated, experience gas and cramps, and yet doctors dismiss it as just reflux. Months later, the truth emerges. A study from the WHO shows that people with chronic unexplained indigestion combined with jaundice face a significantly higher risk of pancreatic cancer. Symptom 5, sudden diabetes. Fifth, a sudden diabetes diagnosis or worsening sugar levels without lifestyle changes. Up to 80% of pancreatic cancer patients develop diabetes before their cancer is discovered. If your blood sugar suddenly spikes, investigate further. Think of it as your pancreas waving a red flag. If you've lived years with stable blood sugar but suddenly need higher doses of insulin or medication, that's not just aging, that's a warning. Symptom 6, abdominal and back pain next. Dull, aching pain in the upper abdomen that radiates to the back. If it worsens after meals or lying flat, but feels slightly better when leaning forward, take it seriously. This pain often gets dismissed as muscle strain, but could be tumor pressure on nearby nerves. Doctors often call it the classic pancreatic pain pattern, but sadly, most people don't connect it with something serious until too late. Symptom 7, blood clots. Seventh, unexplained blood clots, either in the legs, DVT, or lungs, pulmonary embolism. Pancreatic cancer triggers blood to clot abnormally. If you develop clots without long travel or immobility, it's a red flag. Imagine walking into the ER with a swollen leg, only to discover it's a clot linked to hidden cancer. Studies show that in nearly 10% of pancreatic cancer cases, clots appear before the diagnosis itself. Depression and mood changes. Finally, sudden depression or anxiety in people with no history of mental illness. Researchers believe pancreatic tumors release substances that alter brain chemistry. This symptom is often ignored, but it may be one of the earliest warnings. Doctors now encourage patients with sudden, severe depression, especially in middle age, to undergo a medical evaluation beyond psychiatry. Now that you know the 8 symptoms, the next question is, what should you do? First, listen to your body. Don't dismiss persistent changes. Second, seek a thorough evaluation. Blood tests, imaging scans, and specialist visits if needed. Third, advocate for yourself. If a doctor dismisses your concerns but your symptoms persist, ask for a second opinion. Finally, adopt preventive lifestyle choices. Avoid smoking, limit alcohol, maintain a healthy weight, and eat a diet rich in fruits, vegetables, and whole grains. These choices reduce strain on your pancreas and support long-term health. Individually, these symptoms might not mean much, but if they persist or appear together, your body is asking for help. Don't ignore subtle whispers until they turn into a roar. If you've experienced any of these, consult a doctor immediately. Your health is your greatest treasure. Knowledge and early action can save your life. If this video has been helpful, support the channel by liking, sharing, and subscribing. Together we can spread awareness and save lives. And remember, the most powerful medicine begins with awareness. Stay informed, stay vigilant, and take charge of your health today.